Coach Hayes has another meeting he has to be at. He'll probably come back in before we finish. And Representative Smith, we don't know where he is, but we'll go ahead and get started. So just tell us about who you are. And
Thank you. Thank you, Chairman. I appreciate your time, and I will try to not take too much of it. Of course, I'm Georgia Miarton. I'm the State Director for South Carolina First Steps, which is the state's only dedicated early childhood agency. And in that capacity, I also direct the work of the state's Early Childhood Advisory Council, which coordinates the collaboration among 10 different state agencies and entities that all reach and impact young children and their families. And last year, the legislature, thanks to you, actually funded the Early Childhood Advisory Council for the first time in about a decade that we've ever had funds for those programs and services. And really excitingly, I wanted to share with all of you that we have just this past month launched something called South Carolina First Five South Carolina. It's in your blue packet, and this is a single portal into all of the state's publicly funded early childhood systems and services. So families don't have to go to DSS to find out about a food support, and DHEC to find out about WIC, and the Medicaid agency to find out about health insurance for their young children, and First Steps for parenting programs. They can go to one place and find out everything that they're eligible for. Great collaborative program, and that would not have happened without the staff capacity that you all made possible last year. So thank you for that. I wanted to just begin by introducing a few of our team members who are here today. Of course, you know Mark Barnes, who is our Director of Administration. And I'm really pleased to be able to introduce a new colleague. Derek Cromwell here is our Chief Partnership Officer. You've seen Debbie Robertson in the past. She retired. I believe she's going to be recognized on the floor next week by Representative Allison and Representative Govan for her decades of service to the young children of South Carolina. She did retire. And Derek Cromwell is a veteran. We have the veterans preference now in South Carolina, and we were very pleased that he is both a veteran and someone with veteran experience in grant making and funding of programs. And you'll see that part of our change in strategy is to fund grants to our local partnerships in addition to the formula funding that we've provided as a base of funding in years past. So we'll talk a little bit more about that, but wanted you to know that he has that experience. And Caitlin Richards here is our government affairs liaison, so you'll have a resource when you have additional questions. Representative Erickson has asked me over the years and said, well, you need someone to help you with this so you're more responsive and can get us the data, and we now have that colleague in Caitlin. So I'll just walk you through, if it's okay, what our budget request is this year. Okay. And before I do that, I wanted to share a few highlights from this past year. Obviously, you've heard from the superintendent about some of the challenges that we've all experienced in the education space, and that's no different in early education. We heard from parents, we did a survey and heard from parents, 1,200 respondents, parents of young children who came from 42 out of our 46 counties. And they said to us that they were themselves experiencing more stress and anxiety. 75% of the respondents told us that they were concerned about their young children's mental health, and over 80% said that they were very worried about their child's development as they're getting ready for school. And so that's our work. Our job last year and continues into this future is to be responsive to those concerns that families who have young children have. And so what we did is we really geared up our parenting programs, our home visiting programs, the support we provide to child care providers, scholarships for families. And what we did is we were able to dramatically increase the number of children and families served compared to previous years. So you'll see in your packet that this past year, we were able to serve 37,000 young children and over 50,000 parents of those young children. That's a 26% increase from the previous year, and that's all during a pandemic. While we were able to expand, unfortunately, we are not anywhere close to meeting the needs of people who are eligible for our programs. These are children who are most at risk of early school failure. So at this point, 76% of families who have young children that would be eligible for First Steps programs and services are not able to access them. So part of our request this year, our only monetary request, which is $6 million, would provide the ability for our local partnerships to serve more families and children because the need is there, the demand is greater, but our supply of being able to meet that is severely limited by our resources, which have not seen an increase since fiscal year 2017. And at that point, it was only a $1.7 million increase for these 0 to 3 programs. And that $1.7 million increase spread out across 46 partnerships and formula funding can only go so far. I want to share with you some great successes from the expansion of CERDUP, First Steps 4K. We were able to add 50 additional providers. These are both private childcare centers and private schools and charter schools. So by bringing on those additional providers, we were able to see a 35% increase in the number of children served this year compared to last year. And even when we look pre-pandemic, we see an increase in the number of children that First Steps 4K is able to serve. Of course, children who are enrolled in First Steps 4K, I want you to look in your packet and just note that on the kindergarten readiness assessment, these are children who are in poverty, these are children with risk factors, and because they're a part of First Steps 4K, the gap between their performance when they start kindergarten and the performance of all children, including my children who are certainly not in poverty and not at risk, it is completely closed. So while 27% of all of our state's children are ready for kindergarten, and that number is terrible and we need to work on it, I am incredibly proud that First Steps 4K completely closed that gap. And one thing that we look at in all of the research when we try to figure out, Representative Smith, I'm looking at you because you mentioned about the accountability, right? The connection between funding and the outcomes. We look at that on a regular basis. So one of the things we look at First Steps is we're serving kids in poverty. We're serving kids with risk factors. We want to compare them to kids who look like them, who also are in poverty and have those risk factors. So in this EOC evaluation of kindergarten readiness, what we saw is that those children who did not get any formal 4K programs, who were in poverty, only 11% of them started school ready. So think about that 11% compared to the kids who got First Steps 4K who were 27% ready, right? So again, building on what we've been able to accomplish with the funds you've entrusted in us, expanding out to be able to set up more classrooms, to be able to serve more children, which we need some proviso authorization to do so that we can make some headway. That conversation was sort of the end of your last presentation, the lack of increases in reimbursement rates and the classroom grants that we provide for setup. So we are asking for that. But primarily, we just want to bring to you our $6 million request for recurring funds for every child.
Let me ask you something.
Yes.
Are you going to be able to find the teachers?
Yes, we have been able to expand, as I said, by 50 classrooms, which is pretty incredible. I'm really proud of that, and I want to say that for the teachers, one of the benefits of being part of the First Steps 4K program is that we provide extensive support and professional development. So there's a coach who goes into their classroom every week or every other week and works with that teacher so they feel very supported. I'll share with you, Chairman, that some of our First Steps 4K teachers, when they're on LinkedIn, they don't even say that they work for A's Child Care Center. They say they work for South Carolina First Steps. They're so proud to be a part of this cohort of teachers. They get 3 weeks of professional development a year. So I think if we add that additional funding, that additional reimbursement rate, the additional funds for the classroom setup, if we give them what they need at the center level or the school level, then the school or center will be able to slightly increase the pay to the teachers and be able to keep up with the rising costs of materials that
What about classroom space?
The classroom space is in some ways more flexible in the child care domain than in the public school domain. And I think it's one of the reasons I don't want to speak for Representative Erickson, but I know you were part of creating CERDUP. And I think one of the reasons why this mixed delivery system is needed, was needed, and continues to be needed is that we are able to more quickly expand space and modify space. Some of our child care centers are owned by the directors, so it's owner operated. Others are connected to churches. We have many faith-based centers. And then we have private schools that have become a part of our program. And last year's expansion made that a little bit easier for us to work with those private schools. So we've done a real outreach there as well.
Okay.
Thank you.
Keep going.
So if we can go into the budget request and just start with that $6 million ask. As I said, we have not seen an increase to our funding for 0 to 3 programs. And one of the things that I want to call back to is the data around brain development and the importance of those first 5 years. So we really made that case when we were talking about the expansion of 4K. I know you've heard it, but 90% of a child's brain is developed by the time they walked into kindergarten. 90%. And that happens primarily at home. Yes, we have expanded 4K, and that's an amazing resource, but those first 3 years of life, and even prenatally, we have to support our families in developing the reading skills, the fine motor skills. We need to make sure that our children show up at school with the sort of mental health and physical health that allows them to focus on learning. And so that's what the parenting programs, that's what the home visiting programs, and even the childcare support that we provide to make sure that our childcare centers are really high quality, that's the work of our local First Steps partnerships. So the $6 million would support research-based, proven programs. I'm happy to share data. I don't want to drone on. I know we've been here for a while, but I have a lot of data around why our board has selected the programs that they fund and support. And one of the things that I want to make sure is understood about this request is that it would not be a handout to our 46 partnerships. It would not be added to their formula funding. That base would remain, but this would be granted out through both competitive and targeted grants, so that when there's a particular need or a demand or a high-performing program or a lot of children on wait lists. Right now we have 200 children on a wait list in Greenville County who are waiting to be part of Nurse Family Partnership. We have children in Oconee County who need scholarships. We have resources to serve some of the children, but we need additional resources. And with the mechanism that we're proposing in this request, we would be able to target to where the need is greatest and where the outcomes are greatest. And I'll stop there. I've sort of generally talked through our request, but I'm happy to answer any questions that you may have for me.
Representative Dillon.
Thank you, Mr. Chairman. Thank you so much for coming today, and thank you for just giving a little shout out to Greenville County, because I've gotten a few calls about the research-based programming, and I'm glad you are saying that those monies, well, let me tell you what the concern is. The concern is that that sometimes we don't recognize that poverty is in all 46 counties. Mm-hmm. And just because Greenville is Greenville,
Yes.
our poor students, who are underperforming in underserved pockets,
Yes.
whether they can be in Slater, Marietta, or they can be in a rural setting, an urban setting, like where I represent, there are still pockets of poverty.
Yes.
And there's some feelings that I have gotten some calls that those First Steps would not serve those students. So tell me, is that true or not?
It is so important that we acknowledge that there are pockets of poverty in every single county in this state. And we have brought on a PhD epidemiologist to be our chief data research leader in our organization. She's been with us for about 2 years. And one of the things that she's been able to do for us is actually map out to a census tract level where the poverty is, where the greatest need is, specifically for children 0 to 5. And so with that, what we're doing is using those analytics to prioritize where we fund and where we target resources. So in our last round of competitive grants, we already have processes in place to do this. We're granting out some federal funds that were a sub-2 for Department of Education in this way. So in our last round of funding, we were able to prioritize the high-need communities first. That doesn't only take place at the county level. It also takes place at the census tract level, and that's how we're able to really make sure that children in Greenville, children in Charleston County, are also able to get the services they need.
And are you doing that, just to follow up, Mr. Chair, once you have that data, are you double checking that data with your First Step local partner? And the reason I'm saying this,
Yes.
Census data now is getting complicated, because we could look at a census tract, and because of gentrification taking place, it might show some higher incomes, but right next to and in that census tract are still people on what I call, not public housing, because we don't have that anymore, but subsidized housing.
Absolutely.
You know, a whole complex sitting
Right.
in the middle of a gentrified community where you got $400,000 and $500,000 houses.
Right.
So I think you would need some interpretation on the data, or it could be just overlooked because the incomes have come up. And that is the concern about how we're serving all kids and how we're
Yes.
getting to those that really do need the services.
You're exactly right. And we do work together with our local partnerships and to not only provide our local First Steps partnerships with that data, but we've also become a resource for other large-scale community collaboration. So actually, right after this meeting, I have a meeting together with the United Way. And some folks they're pulling together in Horry County because they said, we acknowledge that the only way we're going to move the needle for third grade reading, which is one of their priorities, is to start with early child. And they knew we had that data and that the local folks they could bring around the table could really make good use of it. We've had a number of meetings with Beaufort and Jasper. They have a consortium who's looking at early childhood, and we've been a part of those meetings, both at the local partnership level and the state level. So absolutely, I think you're spot on in that we have to interpret that data at the local level. And that's one of the benefits of the infrastructure of our local partnerships. This request is really a pass-through request so that we could push these dollars out to local communities.
Okay, thank you.
You have, oh, Representative Erickson.
Thank you, Mr. Chairman. Thank you, Georgia, very much for all the updates, and thank you for the work on First Steps. Thank you for the support of our local partnerships. You know that I adore Betty Washington in Beaufort County, okay? I don't know what I'd do without her. She's such a great resource and support for our whole community. I got to say thank you for the visitation programs, family partnerships, and the parents as teachers. The more we can do with those families and interactions and support, especially going through what they've all been going through, the better off our state is. I think you heard me ask the Superintendent Spearman about the CERDEP funding. I'm going to ask you the same thing. I know you've got some in your booklet about that. You talked about the growth, and yeah, that's great. But are you also being hamstrung? I think you are, by the dollar amounts that were set and haven't really changed since that original 2006 legislation. And how can we make it more nimble and agile and available for you to use, given that we know that the areas, Representative Dillard hit the nail on the head, there's poverty everywhere. Beaufort County may look rich on paper, but I can take you to St. Helena Island or to the very tail end of Hilton Head Island even, where people see the glitz and the glam and they do not realize that there are children there living in substandard housing and their parents are making minimum wage and struggling. And we've got to be able to fill the gaps, but often the upfit. Churches are a huge piece of our CERDEP program, and we love that because it brings many families to trust early childhood through their church that who would not ordinarily. We know that. But churches are just like everybody else, especially during COVID. They've really been struggling. They can't pass the plate. They're not getting donations. A lot of things have slimmed down. We've got to be better partners. If we really want to roll this thing out and roll it out across the state, I really think we've got to fill some gaps. So can you talk to us a little bit about that?
Absolutely. Thank you so much for asking. Yes, we are hamstrung in our ability to expand. We have a strategy to expand. I mean, if you'll believe it, we actually have a postcard that we're mailing out to every single private childcare in the state, basically advertising this program, saying, come offer this program at your center. And one of the reasons that we are hearing no's is because the reimbursement rate is low. We need an inflationary increase, and that's what we're asking for, is just that inflationary increase for the reimbursement rate. And you add that lower reimbursement rate together with the restriction, which is a good thing. This is what makes the program so great, a 1-to-10 ratio. When DSS licensing standards, if you're not a part of this program, you can have 17 children who are 4 years old with one teacher, right? So here we are taking away private pay from 7 children and the reimbursement rate is lower than what those private pay families would pay. And then we're saying, oh, by the way, we have these really high standards. Again, a good thing. It's a great program. It works for kindergarten readiness. We have these really high standards, which mean you have to set up your classroom in a certain way that's evidence-based, based on the research, have certain supplies, and yet that dollar amount, $10,000 to set up a classroom, does not take into account the extreme inflation, the supply chain issues that are making costs go up for everything. So we have private schools, we have faith-based centers and private childcares that are just saying, no, we're not going to take this on this year. And so this proviso request would, we believe, largely solve that.
Thank you. Representative Whitmire asked you about the teachers. And I could just speak to my programs, which again, I will say I'm not a participating schools of CERDEP, but I know from my teaching staff that our salaries in the past year have come close to doubling. Number one, because they needed corrections of salaries like we do even in the state, but also to keep the staff morale and their feelings of appreciation given the difficult time we've had. There have been several bonuses and things like that have come across. Are centers able to do that with the funding that they're getting from the CERDEP program?
They are not. They are incredibly restricted in that we have seen a study that the EOC commissioned to look at what the true cost is of operating a First Steps 4K program. That true cost is $7,000 per student. With a reimbursement rate of $4,800, I mean, I'll share this with you. We have teachers, we have community members who come to our board meetings and they say, our teachers need to be paid $15 an hour. And they are correct. At the same time, there is no way that on $4,800 reimbursement rate, we're going to go to a private child care center. And you have to understand, that means that that private individual, I know you get this, that private individual is subsidizing out of their own pocket that gap between $4,800 and $7,000, right? And we're not going to go and say you have to pay your teachers $15 an hour. Is that the right thing to do? Would that keep teachers? Would that provide a better, more consistent early learning experience? Absolutely. But we can't even have that conversation until we get this reimbursement rate up.
What you're doing, though, is actually, and yes, the private and the faith-based folks are having to come up with that money, but what happens then is the cost is then shifted to other classrooms in the center because they're going to pay higher rates to subsidize the program that should be the program that's the better ratios and able to make some money for a program. So it's really, in essence, detrimental to the other care of the children and the parents' affordability of the program. And that shouldn't be our goal here. Our goal should be to provide the right cost reimbursement for that. So
this is a needed adjustment. And I do want to say at this point, because of the expansion, for now, this would not be a cost. This would come from authorizing our ability to use the dollars we already have to make these proviso changes.
okay, so you could use the dollars that you have and come back and give us data on what actually happened when
That's
we
right.
adjusted the rates to see where we are. That's
That's
actually a good place to be. Okay, thank you.
There's
Thank
one
you, Mr.
other-
Chairman.
There's one other thing I wanted to respond to, if I can.
Sure.
You talked about the important role that the faith-based community plays in building trust with families who have young children. And I do want to point out that that is one of the beauties of the structure of First Steps, is that we have 4K, which is a center-based program, and then our local partnerships operate home visiting programs, parenting support groups, as well as support to child care providers and clinic-based programs even now. We've expanded a little bit into the realm of health through some clinic-based programs. And so I wanted to share with you all that I had a call from a pastor who's here in Columbia, and he runs a large AME church, and he said, our community needs more. Our young men need support, and they need to get it when they're little children. When we're trying to run programs for 7th graders, when we're trying to do dropout prevention for 9th graders, it's way too late. And they've been running a First Steps 4K program for years. He said to me, how do we expand and work with your local partnership to offer home-based programs or parenting programs to these mostly single moms who are coming to this 4K program? How do we really help them be great parents so that their 7th graders and 9th graders don't need our dropout prevention? That's what First Steps can do. And we can't do it now. I mean, Richland County First Steps can't take on any more families because they're maxed out. So that's why we're asking for these dollars.
Any other questions? Gary?
Thank you, Mr. Chairman. Georgia, I was interested in your numbers about those kids that, in their readiness, who, the cohorts of yours that did not go through your program, and those who did, the 27% there. How does that compare on a state-by-state basis to other programs and on an international basis with the other nations we're competing with?
I don't have the data. I want to point out, just so we're all on the same 2 pages, this is in your blue folder, and these are titled Closing the Gap. So these 2, I think, is where you're looking. So I don't have the comparison to other states. I will say that different states use different kindergarten readiness assessments. And you heard this in Superintendent Spearman's statements. When we stick with the same assessment, we can look at how we're doing over time. And so that 27% of children ready in a pandemic year compares to 39% of children walking into kindergarten ready the year before, when we were not in a pandemic. I want to point something out here. I know it's not exactly your question, but I think having a single assessment that all those 55,000 kindergartners take within the first 45 days, it's standardized. Having that in place, being able to compare year to year, what we can see is, and this is no surprise, one of the reasons why those First Steps 4K children did better than the children who got CERT up in public school, they did better than the children who got Head Start. One of the reasons that I would contend that happened is because we remained open. We remained open. We were First Steps 4K classrooms were closed from March 16th of 2020 until June 1st. And that was when the governor closed schools. And on June 1st, we started our summer programs, and public schools were not open at that time, and parents needed First Steps 4K. And I'll tell you, I've had conversations with folks over at DSS in the child abuse and neglect prevention realm. You know what happens when little children are left at home with an older sibling? Not good things. And we said, this is not only about education, this is not only about getting kids ready for school, and the results show, this is also about making sure that our young children are healthy and safe. And so we reopened on June 1st, and guess what? That fall, they took that kindergarten readiness assessment, and they performed better. No surprise. You really can't do e-learning with 4-year-olds. During the pandemic, I had 2 4-year-olds at home trying to do e-learning, and it does not work. It is not a real thing, let me tell you as a mama. So, looking at this data over years, and like you said, being able to look at some of the other states, I believe there are 3 other states that use this same kindergarten readiness assessment. I know we modeled it after the state of Ohio. In South Carolina, we've made the decision to be able to break down those kindergarten readiness assessments into the different domains. Some states don't do that, but it's really important to be able to look and see how are children performing in their motor skills, how are they doing with health and social emotional, how are they doing on their literacy, because then we can target our interventions.
Okay. Those states that we do compare with, that we do use the same test, how do we compare?
I don't know, but I can get you that data. I think it's a great question. You brought up international, and I thought that was really interesting. And I think it's important that we do learn not only from research and evaluation of these programs in South Carolina, but also in the rest of the world. So some of the evidence-based program models that our local partnerships offer have actually been around, used all over the world. And interestingly, our most prevalent program is Parents as Teachers. It's a home visiting program for young children. Even pregnant moms can be a part of the program. And there are some amazing studies of its efficacy in preventing child abuse and neglect out of the state of Connecticut. We have studies about how the children who participated in that program performed better in school, and those studies come out of Zurich. So really being able to learn from other states in the world and apply it here in South Carolina, as well as studying the local impact, I think is really key.
Yeah, most definitely. Let me ask you about the grant program.
Yes.
That you're looking to take the Ready program. You were talking about in here about grants will target age birth to 3 years old in rural areas and areas in the lowest readiness for kindergarten. Tell me a little bit more about what you're planning on doing there.
So there are 2 ways that we make these types of grants. And like I said, we already have a process in place and have been able to really test out that process, get some of the kinks out before bringing this to you. So the idea is when we prioritize That doesn't mean that it's restricted. It just means that the applications that come to us that are for young children, which is where the greatest need is, right? 0 to 3 is the period of 80% of that 90% of brain development that we talk about by age 5. Well, 80% of it happens before 4K, right? So that's why we're really targeting those early years, because the research shows that's most critical. Looking at our rural communities, there was an evaluation commissioned that we commissioned, and it's legislatively mandated. And it looked at where the First Steps programs, county by county, where they have the greatest efficacy in closing the gap when you look at children who got First Step services versus other like peers. It was a regression analysis study. And so with that study, what we found was that while the programs are evidence-based and they work in Greenville, to the point we were talking about before, they're needed in Greenville, because there are other resources that children in Greenville can tap into. There are other nonprofits, there are other supports. What we see is that gap closing is greatest in our rural communities. And that's one of the core reasons why we felt like building on that study, we needed to target rural communities. Let's see, did I answer all your questions? And then KRA scores. Obviously, we want to target the communities where we have the lowest kindergarten readiness scores. So if you look at the map, I think it's on page 12 in the annual report, I mean, you can see that in Saluda, in Jasper, under 10% of children came into kindergarten ready. So that means that when we run this process, when we talk about targeted grants, are we going to reach out to Saluda and Jasper and say, would you please, expand your programs? Your children there really need it? Absolutely, right? So that's what that looks like. It doesn't mean restricting it only to 0 to 3. It doesn't mean restricting it only to rural, because again, we need to make sure that we're targeting those census tracts of greatest need, but it does mean prioritizing.
You said it's on page 12?
I believe it's on page 12 we gave you a lot of materials.
Okay.
Yeah, so on page 12 of the annual report, it's this map. And this annual report, I will point out, is required in legislation. And I really do appreciate that, part of our job is to really raise awareness and make parents aware of all the resources that are out there for them and their children. And so by publishing this data, by publishing the state's profile of the ready kindergartner, part of what we're able to do is show families what those developmental milestones are, and then how our programs and services collectively can help get their children there.
Thank you.
Go ahead.
Yes?
Yes.
I just want to conclude, if I may, by thanking each of you for your support, not only of CERDEP and the expansion of 4K statewide, but also of your own local partnerships. I know, Chairman, that our Oconee County First Steps Local Partnership Director, Davy Snipes, was invited to the delegation meeting, and she shared just the support that you and other members of the delegation have provided. In Oconee County, just as an example, Davy runs a program called Healthy Families, and when we think about our collective support for our youngest citizens in South Carolina, I think it's really important for us to remember that a pregnant new mom who has never had a child before, who wants to do everything right by that little human being who she's going to bring into the world, who's scared, who maybe doesn't have any family there in Oconee living near her, who is wanting to get support, she can reach out to Oconee County First Steps, and through Healthy Families America, through this research-based program, someone can come to her home and make sure that she knows how to set up that space to welcome her new baby. She can counsel her on the right supplements and folic acid and everything she needs to do to make sure that that pregnancy is healthy. She can guide her through her choices as she brings that baby home. And she can stay with her, visiting in her home for over a year. This program can extend to over a year. And so those services are possible right now because South Carolina did something that was incredibly unique 23 years ago. We were the second state in the whole country to do this public-private partnership. And without these additional resources, we're not going to be able to replicate those programs to serve more families. We're not going to be able to take care of those wait lists. So thank you for your years of support. Thank you for your local support and for knowing your local partnerships. They're doing the hard work every day. And thank you for your consideration of this request.
Well, Georgia, thank you for your commitment to our young people in the state. There's no doubt, you're right. If we don't get them at a very, very early age, they're not going to be successful in life. And there's so many challenges that when I was growing up, we didn't face, but obviously, different world now. So
Absolutely.
we'll do what we can to help you out, okay?
Thank you so much. We
Okay.
appreciate it.